Hello, everyone, and welcome to Health.Europe.You, the official podcast of the European Medical Students Association. My name is All, and I'm the Secretary General of EMSA. And today, in this episode titled Health Europe Externals, we're going to be talking about what our Vice President of External Affairs is responsible for, what our external department does, and how you, as members, can contribute to the external work of EMSA. And for this reason, we're joined by our Vice President of External Affairs, Alexandra, here.
Hello.
How are you doing, Alexandra?
I'm good, thank you. How are you?
I'm doing good as well. We've actually received a lot of questions about you and your position. And speaking of those questions, you can use hashtag AskEMSA through any social media account that we have, whether it's Instagram, Twitter, LinkedIn, Facebook, to submit your questions in order for them to be answered during a podcast episode. That is hashtag AskEMSA. And after that reminder, if you're comfortable, Alexandra, let's start with your questions.
Yeah, sure. Go ahead.
So our first question is a general one, which I also received. What does the Vice President of External Affairs do?
Yeah, you did receive that one as well for your position. I think, yeah, it's a general question, but it covers a lot of ground already. So it's a very understandable one. So what do I do? So as the position says, I'm responsible for everything relating to external work, so of the organization itself. So that mainly means advocacy. EMSA as an organization works advocacy based, which means that we use documents we write and everything we do in order to advocate for things that we want to advocate for. And my responsibilities basically can be a little bit subdivided, I guess, into 5 main areas or 5 main points. The first one is a little bit administrative. So on one hand, overseeing the work of the Department of External Affairs, which includes the Medical Education Liaisons Officer, the Student Organizations Liaisons Officer, the internship positions we have, and any assistance that a term may choose to have as well. And also the work within as an executive board member. So overseeing the work of the organization in general and everything relating to executive work. So that's the first administrative side. In terms of what the position itself concentrates on, I think the second important point is collaboration. So I am responsible for the collaboration of EMSA with external partners. That includes existing external partners and stakeholders whom we have worked with in the past, so as to continue this collaboration and strengthen it. But also, on the other hand, connecting to new organizations, new possible partners for new possible collaborations. Basically speaking, any collaboration with an external partner, whether that be by the external department or the overall organization, or also by specific pillars and pillar directors who want to work with external partners, all of that has to run through me to a certain extent, depending on what level of collaboration that is. The third big area would be representation. So as the Vice President of External Affairs, I'm responsible for, alongside the Department of External Affairs, represent EMSA on the European level, which obviously also includes everybody else on the board, but is specifically, or the Department of External Affairs is specifically responsible for that. So that includes representing the European medical students in stakeholder meetings and conferences that I attend, or also just meetings that I hold with individual people from other organizations. This representation also includes giving input on documents and presenting the opinions of medical students in Europe when required or when asked for. That means, as I said, giving input on documents, holding presentations or speeches, etc. And in order to do this, because I think one of the main questions that I would have had as a member would be, or that I would have as a member, or that I also had, would be what or how I choose which opinion as the opinion of medical students, So I use documents and content voted upon at general assemblies, or also statements that we write throughout the term in order to speak on issues. So apart from statements and press releases we write throughout the term, as I said, the documents voted upon the general assemblies are voted upon at the general assemblies are very important. These documents include policy papers, or for example, also the European priorities, which were recently voted, or anything that the Department of Internal Affairs writes. After these have been voted upon or published as statements and press releases, we then, as the Department of External Affairs, are able to take the points mentioned there and able to speak about these as the opinion of the medical students in Europe. The fourth main area are these documents. So they're press releases and statements. Those are a very, very large portion of my work. So on one hand, I'm responsible for finding the issues that EMSA wants to comment on based on current events, or also based on issues brought forward by our members or other board members. I then, alongside my team, select these issues and select which ones we as an organization want to comment on in that moment in time, or whether we want to wait, or whether it's not really something we should be commenting on, also depending a little bit on the political situation at the moment taking place. And then together with the Department of External Affairs, or also with other board members, or also members when they want to get involved, I start the research process and we start writing the document itself. As I just mentioned, members can be getting involved in writing of press releases and statements at any stage. So that starts with, for example, bringing forward points or issues which they want us to comment on, or also they're very welcome to be included in the writing of press releases and statements, and in the research process, etc. Last but not least, my main duty relating to press releases and statements is also the revision, and lastly, the publishing of the statement itself. Even if I may not have been the main author, I always look at the document, revise it when necessary, and look at what we state in the document and whether that is aligned with our other policies and other documents that we have, or whether things need to be rephrased or quoted or sourced more, all of that. The very last area that I focus on is also relating to documents, but to the documents that I mentioned that are voted upon at the General Assemblies. So that includes policy papers, and also, as I said, the recently voted European priorities, or anything that's being voted upon. And the Vice President of External Affairs is always included by giving input on these documents, which will be used externally. So that means revising them a little bit from an external viewpoint, giving input if something should be rephrased or something should be maybe looked at from a different angle, but specifically also looking at the recommendations, because our policy papers always include the recommendations aspect or a part. Now, I'm not going to be talking about the structure or the policy paper process, because that will be for the Vice President of Internal Affairs to discuss in an upcoming episode. But basically, this recommendation part includes recommendations that we as European medical students and as an organization make to external partners or other organizations, what we want them to do to tackle the issue that the policy paper is about. And that is what I specifically focus on, because that is what we will represent externally. I hope this gave a little bit of an overview. I know it was a lot, but that's basically the 5 main areas that I work with.
Yeah, I think it gave a really nice overview, and those are actually the reasons why we deem the external department so important. And I think it did an amazing job to summarize it. Let's move on with a more personal approach.
Mm-hmm.
This is also a question that I received, but I want to do what you did to me and divide it into 2 parts. The question asks, why were you interested in, first of all, getting involved on the European level, and what was specifically intriguing about the VPE position that you wanted to become one, basically?
Yeah, I see what you did there, that you divided it the way that I did. But you said what I did to you, like I pushed you into a pool.
No, I mean, it came out of nowhere a little bit.
Yeah, no, I know.
It made the question more interesting.
Yeah, no, I agree. And I think those are also the 2 aspects that the question was probably aiming at. So looking specifically, I think I will probably answer both in one go. But looking specifically at what made me become interested in working on the European level, I think I would look at my journey throughout EMSA, which is something that a lot of EMSA people say, by the way, I realized. So I started my work with an EMSA in my first year, very early on the faculty level, and was then elected LC. So local coordinator, which means that I was coordinating, as we spoke in the last episode, I was coordinating the work of the faculty member organization. I was then quite quickly afterwards elected as national coordinator, basically a little bit recruited at a General Assembly, but was always interested in the political aspects, which is why I got involved in EMSA in the first place. So I was always interested in the political aspects relating to medicine, and as you can probably tell, an overall talkative person who likes to network. So when I was at my first General Assembly, I looked around and I saw, how amazing it was and how great it was to talk to people from, all over Europe and who were studying the same thing, but it's always a little bit different. And to have this input from so many different viewpoints as well on the same issue, that I just really thought this was what I want to do during my studies. I really want to be included in the European level. While I was at that first General Assembly, I also got particularly interested in the external department, and that was always very intriguing to me. And I remember sitting there and listening to the symposium and listening to what the external department was talking about, and just thinking that is really cool, and I really want to do that. So I already pivoted towards that a little bit when I was not even a national coordinator, but a local coordinator during the process of being recruited as national coordinator. And I was quickly voted as national coordinator afterwards. While I was national coordinator, I was then, the board, the former board then approached me asking if I wanted to maybe think about running for vice president of external affairs. And that's how I was, now this is bad wording, but that's how I was sucked in to being an executive board member. And that's how I got into this position. But as I said, I really just always enjoyed the external work, and I always wanted to work on the European level. I'm also a very European person, or international person. I grew up with influences of multiple cultures. I did the international baccalaureate. So it was always very international in my background, and I always wanted to continue that in my studies as well.
I love the way you said that you felt sucked into it. It does feel like that a little bit
it does,
for me as well.
But in a good way.
But it's totally a rewarding experience, totally a rewarding thing to do.
It is. I say sucked in because, you think about running for the position. And in my case, I was thinking about it. And then somebody spoke to me about it. And I was like, oh, so, that would be cool. And then you're in the position, and then you kind of can't leave because it's just so much fun. And I really like the work, and I really like the people that I work with, and in the board, I really enjoy us working together. So that's what I mean by sucked in, that you can't easily let go.
Get out. Yeah, I totally relate to that, and I totally agree with what you said. Let's talk a little bit more about the external partners that you mentioned when you were describing your position. Why do you think it is so important to work with them? And why is it important for European medical students to have a voice heard on that level?
That's a very good question to whoever asked that. That takes me back a little bit to my application, actually. And I think what I'm going to say is probably going to sound a little bit cliche, but I think that every person has a voice. And I think that every person, I think though that not every person has the opportunity to make that voice heard, which is something that I don't agree with. I would want everybody to have that opportunity. But I think that we as students in Europe are really, really lucky having an organization such as EMSA, or also national organizations, or any kind of organization, to be able to make our voice heard through that platform. And I'm going to quote the all surrounding quote that we've all heard before: we need to be the change we want to see in the world. And I know that this is very cliche, and anybody who knows me will know that I don't normally quote very cliche things, but I actually believe that this is incredibly important. And I believe that it is incredibly important to voice concerns or opinions on various issues, and that we as humans, but also we as medical students and future medical professionals, have a duty to a certain extent to initiate change where we are unhappy with something, or with the current situation, or where we see something that is unjust. I have always been a person who believed that voicing concerns is one very important aspect of making change happen, but that just merely voicing the concern isn't enough, but that action needs to be taken, and that anybody who has concerns about something should try to change it for the better. Because having the concerns maybe bottled up, or just talking about it without trying to think of ways to change it, only goes so far and doesn't lead to fast change. Without concrete action being taken, the issue will remain. Additionally, I think that there's strength in numbers, and that I think is why we as European medical students have a voice on that level, and that's why it's so important. As an individual, you can only achieve so much. So when you have an idea, you can go a certain way, but when people come together with the same idea or the same goal, or are working towards a common goal with a common concern in mind, the man, woman, or people power, however you want to phrase it, so to speak, increases, which means that they can achieve so much more. And the probability that their concerns and voices are being listened to increases exponentially as well. So for us as the European Medical Students Association, we come together to work towards a common goal, which I think can be basically described as our vision. So as we stated in our another episode, our vision is a united and solidary Europe in which medical students actively promote health. And we come together to work towards that. And now this vision can be subdivided into various action plans and various points we want to tackle. And that is something that we then do during our term. But we come together, and that is strength in numbers. To go a little bit further in answering this question and why I think it's so important, I want to ask you a question.
Go ahead.
Think about if you ask a medical student, random medical student that you come across, why did you want to study medicine? What made you go into medicine? What is the most common answer you will get?
I think the most popular answer would be to help people, to cure people.
Yeah. And this, again, may sound very cliche, and many people may say, oh, that's something people just say, but I don't think that. I think that people actually believe that. I believe that. And a lot of people I know believe that. Medical students, as you said, oftentimes go into the field to help people. And by definition, that means that they concern themselves with issues which are not necessarily about themselves, but about their surroundings. And that in turn may lead to an interest in issues such as public health, or also medical ethics and human rights, and many other issues, basically relating to the content that our pillar directors or our pillars create, and that our internal department creates, and that we as an organization stand for. I mean, that makes sense because our pillars are made up of members. We are made up of medical students. So that is why we do the work we do. In the world that we live in today, a lot of helping people cannot solely be done by treating an individual patient. Now that leads to, obviously that's an amazing thing, and that leads to the person feeling better and hopefully being healthy again, and that is what we want to do. But for larger changes to be able to take place, other aspects have to be taken into consideration. One of them, not a small aspect of that, is political change, and is the political aspects and advocacy, which has to be involved, which is where we come into play, where our advocacy as an organization comes into play. As EMSA, and specifically as the Department of External Affairs, we advocate for changes on and issues that are important to us and to our membership as medical students of Europe. Our voice does matter, and stakeholders want to hear what we have to say. With movements such as Fridays for Future, we have shown that the opinion of the youth matters. In the end, we want to change the world we will work and live in for many years to come for the better. We want things to improve. And the political realm and governments, as well as other organizations, have increasingly recognized that we as youth organizations in general, or any youth organizations, the youth in general, and specifically these organizations should be included in the decision making and in decisions that concern us. And we as medical students in Europe, as part of EMSA, have to take this opportunity to get involved and to make our voices heard. I know this sounded very cliche, but that's honestly what I believe. And that is why I think that it is so important, that what we do is so important, because it has incredible potential and we need to use that potential.
Yeah, and that, like you said, it also frames why the external department as well, again, is very important to EMSA. And like you said, the partners really give a value to what we say, what our voice says.
Regarding what you just said, that this shows why the external department is so important. I agree with that. Obviously, I mean, I'm the VPE. I can't really disagree with that. But I think that also shows why EMSA isn't just individual departments, but why EMSA is EMSA, and why we have to work together, why the departments are working together closely. And that shows, I think, the value of an organization which works together so closely, interdepartmental, and not just within one department.
Exactly. And like we said, we communicate, we work with these partners because of our voice, and it matters to them as well as it matters to us that it is heard. Speaking of them, who are those partners that we collaborate with, that we work with?
That's a very good question. I think that's also something that may be a little bit abstract when you look at the Department of External Affairs. So I think, very broadly speaking, you can subdivide the categories of external partners into two main categories, also a little bit linking to the positions that we have in the Department of External Affairs. So on one hand, we have student organizations, which fall into the responsibility of our Student Organizations Liaisons Officer, or SOLO for short, which is, as I said, a member of the Department of External Affairs. And on the other hand, we have stakeholders and professional partner organizations, amongst them also ones focusing on medical education, which is what our medical education liaisons officer is mostly responsible for. So firstly, looking at the student organizations, and I will only very briefly go through this because this isn't directly my responsibility. I overlook that work and I do collaborate with them, but not as intensively as our student organizations liaisons officer does. So we collaborate with other students, and not just students within Europe, but worldwide, and not just medical students. So on one hand, we have medical student organizations worldwide, as for example, the Asian Medical Students Association, EMSA, or the International Federation of Medical Students Associations, IFMSA, or many, many more. On the other hand, we also collaborate with other healthcare associations within Europe as part of the European Healthcare Students Association Summit. So that, for example, includes the European Dental Students Association, the European Federation of Psychology Students Associations, and the European Pharmacy Students Association. Last but not least, we also collaborate with student organizations which are not concerning themselves with healthcare things or don't come from the healthcare field. So for example, also the European Law Students Association and many more. So that covers the student organizations. As I said, the other huge portion are stakeholders and partners. And in order, when I talk about them, because that is basically my main area of focus, I have to name one specific thing. So we are part of something called the European Medical Organizations, or EMOs for short. And what I think is very, very interesting about that is that EMSA is the only organization representing students within the European medical organizations. And that network is basically made up of, just as the name says, organizations focusing on, well, medical organizations focusing on the European region specifically. That includes a lot of different organizations whom we are partnering with within this network, but also outside of this network. I think around 9 organizations in total, including us. I don't want to go through all of them, but 3 I want to highlight. So on one hand, we are very close with European junior doctors within this network. Basically, I think very easily put, because they are the closest to us in age. And after we graduate medical school, we would pivot maybe towards there a little bit. Then secondly, I want to highlight the European Union of Medical Specialists, or UEMS for short. I want to highlight them specifically because they are one of the organizations with whom we have an internship position. Now, this is something that we will focus on maybe in another episode. I don't know if there's a question coming, but basically speaking, we have 2 internship positions, which are internships for 6 months in Brussels with 2 organizations, specifically one of them being UEMS. The second one that the third organization I want to highlight is also the second internship position which we have, which is the Standing Committee of European Doctors. So again, we have a 6-month internship position with them, which I can go into at another time as well, into the responsibilities of that intern. But why I want to highlight them specifically is because CPME is one of our main collaborators on a lot of things, and EMSA is an associate member of CPME. Apart from that, we also, and apart from the work that we do with them within EMOs, we also share an office space with them. So that by definition means that we're very close in collaboration. We're very happy to be, to have them as such a strong partner and to be working with them on various things. Apart from that, or apart from EMOs, we are also an accredited non-state actor, or NSA for short, of WHO Europe, which means that we're invited to a lot of different discussions, or also, consultations to share our opinion on various things. And we're very grateful for that collaboration as well. They also, basically all of our external speakers, our external collaborators also join us as external speakers at events and vice versa. So that's also an aspect of the collaboration. Apart from that, we are also working together with other professional non-governmental organizations, as for example, the Association for Medical Education in Europe, or AME for short. This specifically, for example, falls more into the area and realm of the Medical Education Liaisons Officer, because this specifically concerns medical education. Furthermore, we collaborate, or we are part of the European Public Health Alliance, or EFA, and also collaborate with the European Patient Forum, EPF. Last but not least, apart from, like these collaborations and stakeholders we work with, we're also part of various European Commission project, expert group, public consultations, or joint actions. And that, for example, includes the Coalition for Vaccination, where we're part of that, and also the Immunion project, which has just recently launched. I think this gave a quick overview. Now we have a lot more partners that I could go into, but I just wanted to focus on the main ones and on the most important ones, so to speak, at the moment, and the ones that we collaborate with the closest right now. I hope that gave a quick overview.
I think it did, and it showed the spectrum of partners that we have, which is a wide range.
Yeah, definitely.
Moving on to the next question, which is going back to a more personal one.
Mm-hmm.
What do you enjoy most about these partnerships that we have, maintaining those? And what do you think is the most challenging when it comes to that?
Oh, that's a good question. Ooh, that is not easy. What I enjoy most, that I think is very easy. The challenges, that's, I think, what's funnily enough, a little bit challenging to answer. No pun intended. So what is the most enjoyable? I think it can be summed up as one main point. I think, to me, I feel like it's extremely rewarding to see that our opinion is taken so seriously, and that it actually matters to our external partners what we have to say, and that we're actually being asked about our opinion, and that in turn we can actually affect things for the better, and we can actually have an influence on things and better things that we see that we don't agree with. So that, to me, is extremely rewarding, to see that what we do internally and the papers we come up with actually have an effect on the world around us and on the people or in conversations that we have with other external partners. So I think that is why I think that the position is so enjoyable, and why I think EMSA's work is so rewarding. Regarding the challenges, that's a little bit more difficult. And now I want to say off the bat that none of the challenges are really that big of challenges. I think there's three main things that maybe, are aspects. On one hand, it's the level of experience. So we work with people who have been working in these positions much longer than we have, who have been working with external partners or working in external departments much longer than we have, who are professionals already, who are no longer students. Now, this again is only focusing on non-student organizations. So that can sometimes prove to be a little bit of a challenge, but not that big of a challenge. On the other hand, again, only focusing on non-student organizations, other organizations we work with have terms of 3 to 5 years, where someone is in a position for 3 to 5 years at a time. Within EMSA or within any student organization, there's a lot more fluctuation in positions. So they change with a higher frequency, normally once a year. This brings some challenges with it, because that means that we have a position changing every year, whereas another organization has the same person in that position for consecutive years. Now, this being my second term, that aspect was simplified a little bit, because I have been here last term already, so that isn't that big of a challenge. The last point, I think, is time management, which ties again into the experience aspect. And again, it's not that big of an issue, but just something that we have to keep in mind. So this is not our main job. Nobody in EMSA does this as a full-time position. We study parallel to it. We have other things going on, especially right now. Some of us are tied into patient care in hospitals where help is needed, depending on where they are, which faculty they're at. It may be a requirement, or they may have been asked to do so, or they may have just wanted to do so. So we have a lot of other things going on as well. And for our external partners that we work with, again, not for student organizations, but for the stakeholders that I work with, it is their main activity. So there is this difference in the time that can be invested to a certain extent. However, all of these aspects are not real challenges, because our external partners do know that, and they know that we have studies going on, that there may be other things, and they do 100% take that into account. Nobody expects us to answer within 3 minutes, because we don't have a 9 to 5 working day, but we have other things as well. So they're not really big challenges. They're just small things to keep in mind. I don't think there are really big challenges. I think anything can be handled, and it's learning by doing, pretty much, because again, we were not specifically trained for the work that we do within EMSA, but it's learning by doing, and I think we're doing a really good job. And the rewarding aspect and the enjoyable aspect of just seeing that it actually matters what we have to say, that just overweighs all of the challenges that we may face at some point, to me anyways.
Yeah, and the fact that we have working relations with those partners, I think, proves that these challenges can be overcome.
Yeah, they're not big challenges at all.
Definitely. Moving on to another question. We talked about the partners. We talked about how the relationship with the existing partners work. But how does acquiring a new external partner work? Do they approach you? Do you approach them? How does that really go?
That's a very good question, and that's a very concrete question. I like that. So both ways are possible. It's very dynamic. So, for example, if we talk about specific events, I usually reach out to people. So it comes from us. So I reach out to already existing contacts, or I ask them if they know anyone that I could reach out to in other organizations, or I just reach out to new organizations and individuals through different platforms, and or for example, through having acquainted or having had made a connection with them at an event, which right now is a little bit difficult because we're online, but still works. And that may then lead to a longer term collaboration. So for specific events or specific things, I may reach out to them. On the other hand, oftentimes we also get external organizations who reach out to us or who contact us as students for collaborations, and as well to get our point of view on certain aspects specifically. And yeah, they reach out to us. In any case, whether I reach out to them or they reach out to us, I normally first set up a meeting to just discuss exactly what the collaboration would be. This meeting may include pillar directors, or depending on which area of focus it relates to, different people from the board as well. And we then discuss what we would expect from each other in the collaboration. And I then evaluate a little bit whether a memorandum of understanding, which is a contract that we have or that we use with external partners sometimes, needs to be written up. Now, whether that needs to be written up depends a little bit on the nature of the collaboration and on whether it includes financial things or something like that. That always needs a memorandum of understanding, or MOU for short. But if it's without anything financially being included, if it's, for example, just we could also choose to write up a memorandum of understanding just to make sure that both parties or both sides are very clear on what is expected. So if we have a collaboration which includes actual expectations from both parties, we would also opt to have that memorandum of understanding. But that is a case-by-case decision that we make in this first preliminary meeting that we hold, just to evaluate whether we should collaborate and to what extent we could collaborate. Before we hold this meeting, there's a few things that we look out for as the Department of External Affairs, or me as VPE specifically, that I look out for. So we have a few rules within EMSA who we collaborate with and who we don't. And that, for example, includes that we don't collaborate with people who have ties to the tobacco or arms industry, the alcohol industry, or also the pharmaceutical industry. Just to name the main points. So we do look at the organization first and foremost to see if there are any ties, and we do ask them about it as well to make sure whether we can even collaborate, because if these ties do exist, we wouldn't be able to, and I would not be able to, or I would have to say no to the possible collaboration, so to speak. But that hasn't happened so far, so that is very good. And yeah, so it's a very dynamic process. It can go both ways. To answer that question specifically, again, they approach us, or I approach them, or the Department of External Affairs approaches them, or someone in the board knows someone. It's a very dynamic process, but it always starts with a preliminary meeting to just discuss the extent of the collaboration.
Now, we talked about existing partners, we talked about new partners, and we talked about why we work with them. So the question now is, what can a member without a position do to engage with EMSA's work and work with high stakeholders, or at least contribute to the work?
I really like that question as well. So very good question again to whoever asked this. There's a lot you can do. I think it's a very good question because it's so concrete. So if you're a member without a position, and I think the key word is member, I would probably first revert them to you all to just see, do they have a faculty member organization? Do they need to be an individual member and everything like that? So we discussed what a member is in our last episode, if you want to have a listen to that. And if you're a member who's not a position holder within the board, or also as a local coordinator, then, or even if you are a local coordinator, any member, basically, there's various ways to get involved. On one hand, there's obviously the positions, and I would advise anyone who doesn't directly want to go for a board position, or who's thinking about going for a board position in the future, to look at assistant positions. So every term after the board has been elected and has started their term, they will issue calls for assistants. Now, the number of assistants may vary depending on the necessity of the person holding the position that needs assistance and what they deem necessary. So yeah, so there will be calls issued for that, and I would invite you to have a look at those. Apart from that, throughout the term, there will also be small working group calls made. A small working group, or SWG for short, is just basically a working group of members focusing on a specific topic. The topic is chosen by the pillar director or department, or whichever department or area the small working group would be working with. Now, how exactly that works, I won't go into, because that is more of the Department of Internals work, though I also, for example, recently issued a small working group call, so they can also be made from other departments as well. So those are the two main things. But for members who are not position holders or who don't want to spend that much time yet on things, I think a very good way to get involved specifically in external affairs are delegation calls. So we issue delegation calls every once in a while for conferences and events, and I would warmly invite you to have a look at those. And they're being issued through our email platform, but also on our social media platforms. So basically, when we attend an event, or when we are looking at an event or have been invited to an event, me as well as every other member of the Department of External Affairs always tries to get multiple spots to that event to be able to attend with multiple people, so that we have the opportunity to issue a delegation call. And so that we have the opportunity that not only members of the board, but also people, not members from local structures, can attend as well if they want to. Now, this unfortunately is not always a possibility, specifically with high stakeholder meetings. That's a little bit different. But for conferences, we always try to do that. The call is then being issued, and I like to select a mixture of people. I always like to select a part of people, or a certain portion of people, who have had some experiences with an EMSA, but also just as many people who have no experience with EMSA or no experience with external work, or who have just recently started medical school and are new to everything a little bit. So I always like there to be a balance between the two, rather than just sending people who have known EMSA for ages, to give everybody the opportunity to get involved if they want to. The selection itself, I always base majorly on the motivational letter. So two things which I always ask for, which I think everybody asks for, is motivational letter and certificate of membership. These are requirements. Apart from that, depending on the event itself, there may be additional requirements added to the form or added to the call. Now, as I said, I look at the motivational letter and specifically at why the person wants to join a delegation, what this would do for them as a person, what this would do, or what they would use from, what they would gain from that conference or from attending this conference as a delegation member, for themselves as well as for the organization, the local work, EMSA as an organization. So both aspects are main things that I look at. The selection itself is not being made by me personally. Well, it is, but not by me solely. I always have the opinions of pillar directors, which I involve if it's a pillar specific thing, or also of other members of the Department of External Affairs. And the decision then I like to make with the other executive board members. So it's not just me, but actually multiple people giving input. And I am very adamant about that process. Once the delegation has been selected, we then have a first, introduction and call, and tasks are distributed a little bit depending on the event itself. So the main tasks of people as part of these delegations are to attend the meeting, to take some notes, so that we can then write an external meeting report, which we have to write after each of these meetings, and take something back for them personally. But depending on the event, it may also be that we distribute additional tasks if there are any. So yeah, as I said, assistant calls, small working group calls that the Department of External Affairs has, or also delegation calls, which we issue. And last but not least, and I think this again isn't a very little time to invest, but I think it's an amazing opportunity, are internship positions. As I said in the beginning, we have, or as I said a while back, we have two internship positions, one with UEMS and one with CPME. They're live internship positions in Brussels for 6 months. Actually paid internships, and they're really, really amazing opportunity to gain some experience in the work in Brussels. And I do invite you to keep an eye out for those. I'm currently also holding that position at the same time. It's really, really, really an incredible opportunity. And I would invite you to keep an eye out for those. And we will be holding another episode with questions specifically to that, if we have any questions that need to be answered for that. Regarding general member involvement, I think I'll just take this opportunity to also refer to our website, because we are currently setting up a presentation to just include different levels of involvement that a member can have, different levels where a member can get involved in EMSA's work. Also, depending on the time that you have, you may, not have the time to be an assistant right away. But if you don't have the time for that, or you can't invest that time at the moment, you can always opt for delegation calls or things which require less time investment. But there's basically something for everyone. There's also some, you have to in the beginning maybe think a little bit not only about the time investment, but also about what interests you. Are you more interested in external affairs? Then look at the external affairs things, or, in advocacy and that kind of stuff, or more interested in writing documents, then maybe look at the internal affairs. There's something for everybody, which I think is so amazing about EMSA as an organization.
Yeah, I definitely agree. And I think within the external department itself, there is something for everyone. Even if you're
Definitely.
mildly interested in the external work or a lot interested in the external work, there is an opportunity to just try it out, in my opinion.
There definitely is. And I would invite everybody to do so. It's an incredible experience. It really broadens your horizons, because it's not just medical school. It's not solely something, that you study, but it's actually collaborating with people who come from different fields. So that is something I think that's very valuable.
Exactly. Now, the next question is a bit of a hard one, in my opinion. It says, which new partners would you like EMSA to work in the future?
To work with in the future? That is a complicated question. I did not see that one coming. It's a good question, though, whoever asked this. I don't think I can answer this right away, I have to say. We are in a situation right now where we're branching out a lot, and we're looking forward to some very new collaborations, which we have getting started on right now. But also, we're very much looking forward at intensifying already existing collaborations and strengthening them. So I always want to emphasize both aspects. We're not just looking at new collaborations, but also at strengthening existing ones. Because I think collaborations are not just something on paper, but they can actually lead to some really, really good outcomes, and that needs a time investment. So we're also looking at that as trying to strengthen them in that regard. So overall, I don't think I can answer that right away. I don't think that there's any specific organization which I would like to point out at this point, but just to say we're in the process of working with a lot of new partners, and we're really, really excited about that and looking forward to the outcomes of these collaborations. And also always open to new ones, of course.
Definitely. Now, I have a final question for you. I personally have one. How did you enjoy being a guest?
It's different. I get what you said last time with it being a little bit different. Next time I'll be on the other side again. I did enjoy it. I really enjoyed the questions, and I hope that I answered the questions to the extent that, or to a good extent, and that everybody now has a little bit of a better idea of what the Department of External Affairs does.
I think you did.
Yeah, that's good.
And I think you did. And for example, if there are other topics that our members are concerned about or want to hear your opinion on, they can use our hashtag #AskEMSA in any of the social media platforms that we have in order to deliver those questions to you, and we will make sure to include them in an upcoming episode of the podcast.
Yeah, definitely. Also just to underline, if there's any questions that you have about any of the positions that we have spoken about already, or any of the topics, and anything that may have not been covered or that is unclear still, please don't hesitate to also ask about these things, and we can then set up a questions only episode, not focused on a specific position, but on various questions that you have asked. If there's anything specifically for the Department of External Affairs, or if you're interested, for example, in the internship calls, and once we've issued the call on social media, so keep an eye out on our social media and email platforms regarding any calls that we issue as the Department of External Affairs. If you have any additional questions to those, please don't hesitate to reach out to me personally as well. My email address, as well as any other person's email address who will be in this podcast from EMSA side, can be found on our website, and specifically the contact section will also include the email address of the Vice President of External Affairs. And I do invite you to reach out if there's anything that is unclear, or if you would like to know anything more, but do use the podcast and the hashtag as well for that purpose.
Definitely. Well, thank you, Alexandra, for answering all those questions.
Sure.
And thank you to everyone who has listened so far.
And thank you for the questions, everyone, as well.
Yeah, definitely. And we hope to see you on the next episode.
Yes, thank you. Bye-bye.
Bye-bye. Bye-bye.